this is I feel like this is quite an all-star group. So I'm not sure I'm going to say much that you all haven't, seen in your own work or experienced from just being such embedded members of our community. But I do think that I've been reflecting a lot on how many of us on this call are exquisite crisis responders. And I think that what that ends up meaning sometimes is that we just kind of get on to the next crisis whenever the next crisis occurs. And so I have really been trying to take time to just sort of like ground and think about and reflect on, like really genuinely reflect on everything that has happened since the pandemic started, and really trying to make space for just going through that and playing things back and really just breathing into whatever happened. And so I do think that even if this all might feel like or might be review for folks, it still feels important, I think, to make space for what happened and how now when we see that we're on the downhill, what we're really seeing and what we know as people who work with folks and who have experienced trauma ourselves is that often at this kind of moment when we start to see things shift and vaccines are coming in and hope is sort of returning and we're starting to think of what life might look like back to normal, that's often when the trauma really hits. And so we're definitely seeing that, I think, in ourselves as employees, and we're also seeing that in our shelter guests as well. So I want to just back up first and let's see here. I've just got a couple images, no full presentation or anything like that. But I think when I think back to kind of what happened and what was the context and what was the framing, some of these images and campaigns come to mind. I mean, if you can put yourself back in that time of, January, end of January, February into March, how uncertain everything was. And it was really unclear of kind of how serious was this thing and what was it going to look like for all of us. And all the messages that we started to receive from public health and from the state government was really stay home and stay healthy. And that was the message that we were receiving for folks who are housed, who are in this work. And so there were kind of two things happening. That messaging wasn't relevant for people who were unhoused. And even though it wasn't relevant, no messaging was getting to people anyway. So there was no real concerted outreach effort or even information to service providers that would be relevant for the folks that we were serving. It was just stay home, stay healthy. Stay home, stay healthy, spread the facts, which was really difficult when we weren't really getting that many facts, and so it felt like this thing where on the one hand, the messaging was really simple. And then on the other hand, we were in positions every day to see how not simple it really was and how all of the things that we know of the lack of access that people have to having their basic needs met every day was just becoming more and more and more and more into focus every passing day that the pandemic progressed. Sorry for the blurry picture, but just talking about, we have to stay home, but if you have to go out, like if you must go out, wear a mask. Especially early on in the pandemic, masks were incredibly hard to come by, particularly for homeless service providers. There was a lot of times where there were like PPE tiers, and homeless service providers were often 4th, 5th, 6th on the priority tier, even though we were managing congregant living spaces similarly to nursing homes or assisted living facilities, which were obviously, as we all know, one of the hotbeds for passing COVID-19, yet congregant living situations, congregant shelters indoors were always sort of deprioritized in the response. And then wash your hands. And as we know, with as many unsheltered people that we have living in encampments, hand washing is incredibly difficult. We went on a scramble to, many of you on this call helped with the efforts to get hand washing stations. And there was a time, probably, I want to say in April or in May, where there were none. There just weren't any hand washing stations. They were all rented out. They were all already like used up. And so even if we wanted to have gotten hand washing stations into centralized locations, they weren't being serviced, or they literally weren't available in Thurston County to do that. So there's a lot of kind of public health related things that I'm going to talk about, or that we all kind of know that were really difficult for folks experiencing homelessness. But I think that what was really the hardest part was the psychological impact of the world closing down around people, and people not really, it was like the combination of the world closing down around people, as well as no messaging or actual information that was relevant to their lives getting given to them about what was happening or what they were supposed to do. And so we had a kind of town hall meeting before. So we ended up splitting our shelters to do social distancing in our congregant shelters, and we opened another location. And before we did that, we had a meeting with everybody just to kind of talk with folks about how they were feeling, why all of a sudden all the staff members that they've known for years that have been working with them are masking up and wearing gloves around them and not giving hugs and not doing some of the things that we, really do in our organization to provide a sense of home, to provide a sense of hospitality and welcoming environment. It was suddenly very cold, and there was a lot of like fear of touching one another or fear of being near one another. And that was really confusing for a lot of our folks. As you all know, working with people who've experienced extensive trauma, change is really hard in general, but really fast change is even harder. And so, especially when the people that are meant to be keeping you safe don't often have the information themselves to try to make that change happen in a trauma-informed way, the way that we try to do with everything else. So we had a community meeting, and I just remember two main questions. So I did sort of an overview for folks of like, what is the coronavirus? What do we know? What is it going to mean? And how are we going to keep people safe? And then we did a Q&A, and I remember two questions really stood out to me. One was someone who was so afraid that her dog was going to get it, and asking me like, what's the rate of coronavirus infections for animals? And I was just like, oh my gosh, I have no idea. I have no clue. I don't know. I don't even know what it is for humans right now, but it was like her family, her dog was her most important, need in that moment, was like, how am I going to keep my family safe? And then the other question was from someone who met all of the markers for high risk of death to COVID, in terms of age, in terms of chronic illness, in terms of environmental factors, everything. And I remember asked during the thing, is there anybody that's more likely to get this than anyone else? And I just had this moment where I was like, it's you. I mean, it's you. Like, how do I now in front of this whole group say to you that it's you, and just thinking about how isolated and left out from society our folks are already, and then just how much that deepened and that came into focus in such a real and new kind of way with this pandemic, or I guess like not a new way, but like a more physically visible way. And then, as many of you know, one of the biggest kind of heartaches of the pandemic was that the Providence Community Care Center closed. And it has not reopened, and it closed on March 15th of 2020. The week leading up to that, we had transformed the intake procedures. We were doing symptom screenings for every person every day that was coming through. We were still serving many hundreds of people per day. And this was when the messaging around hygiene and hand washing and all of that was really prevalent. And so it felt very, very difficult that the main place that people went for clean water, to be able to take showers, to wash their hands, to get a reprieve from the street, closed. And I think there were a lot of reasons why that happened, but I think that really aided also that psychological trauma that happened, that it was like, even the place I go every day where Interfaith Works is, where BHR is, where Providence is, where the people are that support me, like even that's closed. And the library was closed. Other places, that last picture, you know, the Starbucks, a lot of people would go to the Starbucks every day for support and reprieve. And so it was just like all of the spots that people would go to feel safer, closed down around them. And I think that one of the, Matthew says, thanks for these slides, although a bit depressing, it's a reminder of the work there is still to do. And I do really appreciate that. And I don't want to only paint a picture of gloom and doom, but I think that as professional and exquisite crisis responders, we often kind of gloss over like how hard things actually were. And so I really want to not do that with this, because I think there's a lot of lessons to be learned. But what I will say was that what I saw during all of that time was every single provider pivoting to the best of their ability to do kind of the most with what they could. And so there was still a lot of really beautiful moments. Like, so March 15th, the community care center closed, and March 16th, the very next day, without missing a single day, we went to 24-hour sheltering so that we knew that at least the folks who were staying with us had a safe place to be during the day. Other organizations stepped up to increase outreach that they were doing. Providence and other medical community members like Valley View and other folks, they provided PPE to us that they couldn't use. So a lot of the hospitals would get boxes of PPE that were open, that were donated, and so they weren't able to use them, and so they gave them to us, and we were like, yes, please. We haven't had N95 masks once yet. And then, you know, I think we all remember too, just the outpouring of community support for sewing masks. And we ended up getting thousands of masks donated to us by people who had sewed them for us with a lot of love and a lot of care. So that there was a lot of really beautiful things happening at that time too. But it was very, very difficult. And I think that frontline workers really bore the brunt of, you know, the lack of kind of cultural competency around people who are unhoused and people who are living in shelters that our, you know, State Department of Health don't really have a big understanding of, or really prioritize what it means to actually message things to our whole community. Like, what does it mean to actually be doing public health for literally everyone. And we still have a long way to go with that. So another kind of big piece that was really difficult to figure out was quarantine and isolation for people who did end up testing positive or were getting a test and needed a place to wait for their results. And Keely and others on the call from the county worked really, really hard to make sure that that was done in as kind of trauma-informed and harm reduction-based way as possible. But again, there's disconnect there between sort of what best practices might look like for a COVID quarantine and isolation hotel and what the reality is for people who are houseless who might go there. And so one thing, we have been, blessed and lucky enough to have only had one cluster of cases in our shelter during this whole time. And it was actually recently back in April. So we had 6 positive cases, and we had to end up moving our entire shelter, one of our entire shelters, into the quarantine and isolation facility. But what was really cool is that since we had 24-hour staffing already in place, we just transferred a lot of those staff to the quarantine and isolation, and they worked together with the county staff who were there. And this ended up being really key because we had relationships with all of our folks already. And that was really the only reason anyone stayed for the full 2 weeks. So a lot of the requests that they were making were requests that maybe quarantine and isolation staff wouldn't have normally been able to or had the capacity to do through the county, like cartons of cigarettes for everybody, like certain different things that were really necessary for having people stay put. And so I'm happy to report that we had all but one person stay put for the whole 2 weeks. And all the folks except for one person is still extremely sick, but everybody else has healed. So we are still, putting all of our thoughts and energy and love towards this person. And other shelters also, to our knowledge, had pretty low overall rates of any kind of positive cases across the whole sheltering system. So the youth shelter had to close a couple of times, but that was really only for like one or a couple of cases. And other than that, we haven't seen any major outbreaks in encampments or other places where folks are unsheltered. What I have seen over the decade more that I've been doing this work, whenever there's kind of widespread influenza or any kind of other things, it often hits the homeless community later than everybody else. And so I am a little bit worried of what it's going to look like moving into the summer and into next winter, of what the impact might be on our folks. So, things like testing and things like vaccine distribution have been pretty difficult. Although, like Keely said earlier today, it's getting much better. One of the things we're struggling with right now is vaccine hesitancy among our shelter guests. At our one shelter, we saw much higher rates of people getting vaccinated, and that was the one that went to quarantine and isolation. So we used that as kind of a bribe, I guess. We were like, if you don't want to go back there, get a vaccine, and so we saw higher rates of folks get that there. But at our downtown shelter, we still probably have less than 20% of people who are getting the vaccine. There is a lot of fear, again, that psychological trauma of the world closing down around them is kind of like a Venn diagram to the vaccine hesitancy, because there's a lot of fear of kind of government control or getting isolated further from society, getting taken out of society. And so having to show folks that, having all of our staff vaccinated, having other people vaccinated who are in the shelter, that's always a big motivator for people. When they see the people that they love being okay, then they might take that step too. So I think it's just gonna take time. And then also that the vaccines have so far been really tied to appointments, and that's been very difficult. So the public health department, and I think this might be changing a little bit, but the public health department has been really like we need to know the exact number of people that are going to get vaccinated in order to bring the vaccines to the shelter or to encampments or whatever. And that's really difficult to do for everybody who, you know, has done this work for a long time. You know that drop-in services and being flexible and nimble are really the best way to get participation. And so that's been difficult to navigate as well. I'm not really sure how much time I have, but I think that those are kind of all the main points that I had to share today.
I think you could speak until 10:30. We're here until 10:30.
Oh, awesome.
But I think
I'd love to open it up for discussion.
Yeah, I think one of the best things about these meetings is when there is time for questions and discussions and brainstorming. So one of the things that I wanted to say in the beginning when you're talking about all of the messaging from the Department of Health of stay home and stay healthy and wash your hands was the frustration of watching across the country encampments being bulldozed. So you would have these stay home, stay healthy, and then they would be destroying people's homes. So how, you know, it's just this disconnect that's so frustrating. And then also watching all of the, in Mason County, like the public park bathrooms shutting down. So where are people supposed to wash their hands? In our shelter, we only have one place for showers in the entire county. And they were, you know, limiting and so what do folks who aren't really allowed to be in that space anymore, for people who've been exited, like where do they shower? Where do they get clean? And seeing that huge disconnect, not just locally, but all around the country has just been so disheartening. So thank you for all that you do. And, you know.
Well, and I think too that, you know, another thing that really stuck out to me in that community meeting that we had towards the beginning was that was really a big thing that came up, and also laundry, you know, because at that time we still thought that it was really sticking to clothing and could really be on surfaces a lot. And so there was a lot of question of like, well, and at that time at our shelter, we didn't really have the capacity to do people's personal laundry, but so we would always have folks go to the community care center to do their laundry. So we just had to start doing it for people. And so, but one of the things that stood out was that one of the shelter guests who had been living in an encampment for many years before the shelter did a demonstration about how to take a shower in a 5-gallon bucket, and like did a demonstration for the whole group, you know. And I just was like, oh my gosh, this is so the thing, right? Like public health, and no shade to anybody here from public health, like professionally, but I think that you would probably agree, but it's like thinking about the AIDS epidemic, or thinking about other times that we've gone through this in our history, and where peer response and people with lived experience and people most impacted are keeping each other safe, because we know that the systems that are set up to support society leave us out. And that's always been the case. Like that's the origin of syringe exchange. That's the origin of harm reduction. That's the origin of, you know, safe programs around sex work and safe programs around drug use and all of those things. And I think that I was just like, yeah, here we are again, even though this might be like a less stigmatized pandemic than maybe others that we've experienced, it still is really relying on people who are the most impacted finding creative ways to keep each other safe.
I had a question. So you were saying that it's been kind of difficult to get vaccinations into the community because the health department wants a specific number, and it's hard to get that. You know, how specific of a number do they need? Because maybe it's a question of scale and I'm not getting it, but our building is next to the health department. And even though I'm not a state worker, I walk around my building like the state workers do. And at the time that I do, the mobile vaccine setup they have out there, they're continually walking over and saying, anybody want free immunizations? Because we have a whole bunch of unused vaccines right now. So I don't understand. I mean, how specific of a number do they need to go there? Because I'm sure they could handle that. I don't understand that.
Yeah, oh, go ahead, Christina.
Well, I can't speak from the health department about that, but what I do know is that vaccine is frozen and there's like 10 to 15 doses per vial. So in order to know how many to unfreeze, and I think you have to use it within X amount of hours, 24 hours, do not quote me on that, that is not a correct number. But you have to use that within X amount of hours of being unfrozen. So that's one of the logistical difficulties and why agencies are tending to want to have more of a specific number. Is what's happening sometimes is they're unfreezing large amounts, expecting a large turnout. And when they don't get that turnout, they literally have to throw away vaccine. And so we've seen a lot of issues around the country of like hundreds of doses of vaccine being thrown away because they unfroze more.
Right.
But
so
if they're doing what you're saying, well, if they're, I mean, I can't speak to.
Yeah, but I mean, if it's that urgent, why don't I just have a minimum number? Okay, we'll have 20.
Yeah.
And if there's more than 20, we'll come back again. But at least you'll get 20.
So since Keely jumped off and I've been involved in vaccine planning, I'll jump in. It's exactly what Christina said. It's about the refrigeration and the temperature cooling during transport and all of that, and making sure that we're not bringing a large amount of doses that then end up getting wasted. The reason for wanting an estimate too around that is because when we're looking at targeting populations like this that are like really specific subset of populations, you're not looking at huge numbers. But when you're looking at a vial having a dozen doses in it or something like that, you're not vaccinating dozens of people at these. So trying to get an estimate really is more important when we're doing the smaller numbers, just because we're not having like a minimum of 50 available, because there's not 50 at the events. I know that when we did one of the events, there was like a dozen people. So it's a lot smaller numbers. So making sure that we're not overestimating the amount of vaccines that then are going to end up having to be wasted because they were not refrigerated.
Yeah, but what about underestimating? So like come with 5. And if there's 12 people there, well, at least half of them got back. I mean, this thing scares the crap out of me so much that I've avoided seeing my son for a year because I was scared of being responsible for anything. So from my mindset, it's like you vaccinate 3 people because you only bought, or however, I don't know. I'm ignorant of this, so I probably shouldn't say anymore. It's just like, it seems that we could do something, even if it's a minimum.
I have to go to another meeting, but I just want to say I wish there was more communication in advance about what is being out there. It seems like I'm getting it the day before that it's going to be happening this, and I don't have enough time to really distribute it out to our communities, especially the underserved population. So I don't know if anybody has ideas about that, but I'd sure love to brainstorm how to get it in advance so we can really make sure folks are able to be there.
Thanks, Shelley.
Yeah.
Yeah, and I'm curious too about ways, and so in the chat, Lawrence said there's a good webinar series about vaccine hesitancy and those in the BIPOC community. There are 2 webinars left. Here's the link to register. So Myra, if you could make sure that that link goes out. One thing that I've been noticing at the syringe exchange is a lot of vaccine hesitancy and talking to folks, and I'm wondering if there's like certain languages or certain things that you found to be successful when talking with folks about vaccine hesitancy. And that's open to everyone who's communicating.
I mean, I think so. I've in attending the 2 webinars so far, and then having just conversation with an organization as well as just learning more about the hesitancy. Obviously, understanding what I keep hearing is like you have to understand the history of why people are hesitant to get vaccines in the first place, and how it's affected the BIPOC community, and how that community has been used as, and to be candid, lab rats in things, and it's in inhumane ways. And so there's a lot of there's a lot of hesitancy because of that. But I also think that one of the things that I've heard, and there was the webinar yesterday, that misinformation is a really hard thing to continually to have to tackle when people are saying things that aren't necessarily true about the COVID vaccine. And so I think that is the biggest challenge, is in trying to have conversations with people about the vaccine and how it really does help us move forward. But it's also I guess what I'm trying to say is it's understandable why people are hesitant to in the first place. And if you don't understand the history and why, then I think it'll be really difficult to try to reach that population.
Something I think also happened for us, like we keep having these moments where we're like, oh, okay, next pandemic, we're going to be like so ready, like don't get all of our staff vaccinated on the same day for the second shot. Next pandemic, staggered vaccines, like, but one of the things was that when our shelter was in quarantine and isolation, some of the folks who tested positive were really like, COVID's not real. It's not a real thing. It's like, that kind of vibe. But then they got COVID. But because we had relationships with people, and because people didn't have contact information or weren't able to be gotten a hold of, public health communicated with me what the test results were, and then our staff told people. And what we found that way was that people were like, they didn't believe it because it wasn't like a piece of paper that a doctor gave them to tell them that they had COVID. And so that was like this interesting thing. And maybe even if they had gotten a paper, they still wouldn't have believed it. But I think that that's really a good point that you're bringing up, that we just have to understand the full picture of what people are bringing into those conversations. And I think that was what was really hard for some of our staff, was that it was like, just wear a mask, everyone. Like but it's like, people aren't in the same place, particularly when they're unhoused and don't have their basic needs met, to be able to have those same sort of priorities. Safety just looks really different for folks who are, in that position. So
I was thinking about that too, how I think that vaccine hesitancy just looks so different for each different marginalized population, for each different, subset that we're talking about. Because, my folks are all people who experience psychosis, and we found like the best thing was honestly just to keep asking, because, some days paranoia is really high, it's really difficult to get through it, the voices are really bad. And so going to a clinic is just not going to be on the table. But then if you ask, the next time, maybe it's a good day, maybe the voices are being more chill, and then people are more willing to go. And the other thing that we found was just being really open about our own vaccine experiences, because people would be like, well, are you vaccinated? And be like, yep, and here was my experience, and I didn't feel great, but this is, and we had folks on our team that got all 3 shots. And so we were able to be like, oh yeah, Priscilla, she got this one, Emily, she got this one. And so for our folks, that was work, but I don't think that would translate to different populations in the same way.
Are there other folks who've had experience with talking with their people about vaccine hesitancy? Cool. I'm still learning how to use my words well with people in certain ways.
I was just going to add that one of the things and I don't know, Katie, if you have more thoughts on this at all, but I've noticed that there's like a major shift in public health response towards vaccines, and kind of away from, or maybe not away, but just less of a focus on testing and quarantine and isolation. And that's a concern of mine with what I said earlier about how sometimes these things hit the houseless community later. I'm getting worried that there's going to be, because we already saw that when we went to the quarantine and isolation, that there's not going to be continued funding or support to keep quarantine and isolation in hotels open for people who are unhoused, or just all the focus on vaccinations and how that might not, again, meet the reality of what people are dealing with who are unhoused.
I think that this is one of the really prime examples of, especially when we're dealing with really large scale things like this, that the funding does not always align with the actual boots on the ground priorities and needs, because things like operating Q&I and pop-up testing and all of that, that's all funneled through funding that we're getting from state and federal levels. So when the state and federal level shifts its priorities, then we're kind of bound to that. So while we know that should still be a priority, especially in the unhoused community, if we're not getting adequate funding to continue operations, we just don't really have any options. And I know that it seemed like the broader public health switch has been from testing and Q&I over to vaccination, just because they wanted to see people get vaccinated really quickly. So there was that push, but I know that there's a lot of us that also have concerns as to what the fall and winter will look like at this point, because even not just in the unhoused population, but in the general population, there is that vaccine hesitancy, and vaccine rates aren't as high as we would like to see them. And funding is going to change or disappear or reduce from state and federal levels. And so I'm worried for what fall and winter could look like then.
With also with variants too. I know who was it? Somebody was talking about being excited to not wear their mask. And I'm like, I'm never going to take my mask off.
I read an article this morning that said expect for a spike in the fall with potential mask requirements and social distancing and lockdowns. And I had to double check the date that it wasn't an article from last year. I was like, this has to be old. And I was like, nope, this came out 2 days ago. Okay.
Yeah, and I think we just have to be, adaptable and go along with, there's just new information every day, and it's hard to keep up with the new information, and I don't know. Does anybody else have any thoughts or questions or moving?
I was just saying, I think this is just a really challenging, it's been a really challenging year. I mentioned it in the chat earlier. It was before I started at Choice, I was a program manager at a family shelter in Tacoma, and navigating COVID and even navigating requirements to get people, because we partnered with the health department. We had people getting tested every 3 weeks. And so we had to pretty much mandate that all clients get tested. And thankfully we didn't have any cases of COVID in the time that I was there, but it was very challenging trying to navigate. And I imagine that it's even more tricky, because I think when it comes to vaccine efforts, I don't think it's just vaccine hesitancy in certain communities, but I also think there's a variety of reasons why people don't get the vaccine, for medical reasons, or even people I know there's been advice to get your vaccine even if you had COVID, but some people are hesitant to do that because you don't know how long immunity is. And so I think it's just I think it's not just vaccine hesitancy, but it's a lot more trying to navigate some of the political uh, conversations around this too, because a lot of this has been politicized too, and it's really challenging when you're trying to deal with people's different political opinions, personal opinions, religious reasons. So I think this is just going to be an ongoing conversation, honestly, and especially if it's going to come back in the fall. It's going to keep coming up, unfortunately.
And another thing that we're noticing here in Mason County, which is a very rural community, is transportation, because we were doing all of these, drive-through clinics, but you had to have a car and you had to be able to make an appointment, and the appointments would, we'd do 700 doses in a day, and those spots would fill up within 8 minutes. And if you didn't have good internet access or navigating the phones, it was really hard. And that doesn't work for a lot of people. And as Meg said, what we've learned for decades of working with populations is appointment times don't work. And we did, one thing I love about our vaccine pop-up clinics is that there were no appointments. It was just, show up between these times and you could do it. And I know in North Mason in the Belfair area, one of the clinics was doing walk-in, so you didn't need a car for that. But it just logistically, there's all these folks who, how do they find out about the, it's like if they're not online, because we have a lot of an older population of old loggers who don't have internet, who don't have cell phone access in their homes. How does information get spread that way? And so there's just all these things I don't think we quite have answers to yet. Are there things, I'm trying to articulate a question. At this point, like, are there any recommendations, or like, what are you seeing the needs? Like, we're almost a year and a half into the pandemic. There's still a lot of uncertainty. I think there's a little bit less fear as we learn more about the virus and how it's transmitted. But at this point, like, is there anything moving forward that would be especially helpful to the community, or what are you seeing the needs now being?
Well, I'm really excited to hear what Keely shared just about the getting into a regular rotation, because we see that with anything that we try to do with folks, like just having consistency and showing up multiple times, participation increases kind of for whatever it might be. So I love that public health is, or that they're doing that and getting access to the one shot. When the Johnson & Johnson got pulled, I was like, no, because I think that that's something our public health has done really well, is set aside Johnson & Johnson vaccines for the Olympia Free Clinic and for efforts that are going to unhoused people. And so that, I think, is an awesome strategy. I'm also trying to figure out partnering with Valley View to be able to get our shelter staff. It's called like a CLIA waiver, so that we could do rapid tests at the shelter. So if somebody's symptomatic, or if a new person is coming to shelter, that we would be able to do a rapid test there, because that's been another thing, is that a lot of the shelter bed capacity has either shrunk or beds have gone unused, because there's a lot of like concern about bringing new people in. And so some of the shelters have required people to have a negative test before they can come in. And of course, there's so many barriers to making that happen. And now I think CMAR is making people pay for tests. So tests aren't even free anymore. Or not covered by insurance or whatever. And so I think that, and I'm not sure if that's a consistent thing, but I know I've heard multiple times that people have been told that they're going to be charged for testing. So I think that making testing continuously available for more people to be able to do it somehow in a safe way, and continuing that outreach for the vaccines, prioritizing the Johnson & Johnson is really good. I don't know. I don't know what other ideas do other people have. I certainly don't have all the answers.
I mean, it seems kind of small in the scheme of things, but one of the things that my folks are really struggling with is just loneliness. You know, already just to be psychotic is to be kind of left out of society and to not have, you know, even kind of the ability to just be in stores and have people close to you or brush past you, or, you know, even we're still seeing folks in person, but trying to kind of limit it and do hybrid models. And so just kind of, you know, I'm always trying to think of how to help folks with psychosis be part of this community. You know, and it's because so many of them are, I mean, a lot of my folks use because that's the only community that will accept them, you know, and just, you know, I wish there was more spaces that my folks would feel comfortable in and supported in and feel connected. And I think the pandemic has really just highlighted that for me, of how isolated folks feel all the time.
Heather, that reminded me that we're going to be partnering with the Poverty Scholar group. That's like an effort that's out of San Francisco, and they're going on a tour, and it's all people who are either currently or very recently houseless, and they do different like events, and there's going to be one at Deschutes camp, and then we're going to do one on June 12th, I believe, that Saturday at Sylvester Park, and it's going to be like a poetry writing, kind of just like healing from the pandemic, isolation from the pandemic, things like that, like an open event with a hot breakfast at 10:30 in the morning at Sylvester Park. And maybe I'll see if we can get vaccines out there. I don't know. But and people, the Poverty Scholars and Poor Magazine, that's kind of who it is, but they provide stipends for people, $25 stipends for poems that are completed. And so that would absolutely be, you know, kind of a safer outdoor gathering that people could come to, and people with psychosis would be absolutely accepted and welcome there.
I think also with isolation, we're seeing like a big increase in overdose rates and suicidal ideation and just really difficult things. And, you know, because a lot of my work is with folks who are actively using, and we're seeing new people at the exchange that we'd never seen before. And I think that's because maybe there's less like secondary distribution, because a lot of our folks, you know, will pick up for 20 people. And so we're seeing all these new people, which makes me feel like people are hanging out less and using alone, which increases the risk of fatal overdose. And then there's, you know, overdose, naloxone outreach has been reduced, you know, so it's having to come up with these creative ways. And you can't, you know, like in our harm reduction messaging, like we always want things to be really realistic, and saying don't use alone. It's like one of my biggest pet peeves is like in the overdose harm reduction messaging is like, don't use alone. It's like, well, that's not realistic. And a lot of people are using alone because they want to use alone. And a lot of people are using alone because they don't have anyone in their life that they can be using with. And then with shelter in place, it's like even harder to do. So that's just one thing that is ever present, I think, and that we're just continuing to see like increased overdose risks. And then with the increase of fentanyl supply being in Western Washington, which I think is just going to increase substantially. The drug world is changing. And so, yeah, it's like, how do we I don't know. I think people are starting to be less isolated and do more. And then I share the fear of Meg of what will COVID look like, you know, as restrictions are lifted and with low vaccine or lower vaccine rates than we were kind of hoping for. And I don't know if there's an answer for that. Are there any other lasting thoughts or things to be brought up?
I was just gonna say, Katie put it in the chat, but the county has been doing pop-up clinics with the J&J vaccine, and I think that's what Keely was sharing about. Katie, correct me if I'm wrong, but that's gonna continue on a rotation between certain locations like Ensign Road and other places. So that's gonna be a more regular thing, Kiyoki, that is, I think, gonna really help.
Yeah, so it's partly the county and then a lot of the Olympia Free Clinic doing the heavy lifting on that. Most of the Johnson & Johnson doses that the county are getting right now, the reason why you're not seeing the public clinics be Johnson & Johnson is because the county's allotment of Johnson & Johnson is going to the free clinic to target houseless folks. So those doses are never even opening up at like fairgrounds and things like that, just because we want to prioritize those. But all of the ones that Keely listed at the beginning of the meeting, like Deschutes, the ones that happened at Ensign Road and the Jungle, partnering with Aggie Hop, all of those were Johnson & Johnson clinics that the free clinic and public health did. And then we have been planning to go to Deschutes for a couple weeks to get that routine wound care available and to build more rapport with individuals. And then Wheeler and Nickerson will be the next pop-up clinics. And when the free clinic's been doing the pop-up clinics at encampments, they go once a week with the Johnson & Johnson vaccines.
Thanks. I really appreciate everyone's patience with my combined emotions and ignorance about that issue. Thank you so much for helping me understand the situation better. I appreciate it.
Yep, that one, I can see why it would seem like we wouldn't have any. The Johnson & Johnson clinics that we've been doing, kind of the not advertising, but communication to the public has been a little different just because they haven't been broadly advertised as a public clinic because we want to reach the target population. We don't just want everyone coming and flooding to the event when they could go and take advantage of the 2-dose clinics at the fairgrounds. So it hasn't been as broadly publicized and communicated just to avoid people being like, I would rather have the 1-shot one, and then all of those get cleared out and we don't have any left to take to the encampments.
Have you noticed increased hesitancy around the J&J since it was recalled and then brought back? Are there less people who are wanting to do it?
I didn't see anything with that. I was at one of the clinics right after it was rolled back out and okayed, and I didn't hear anyone even mention it. So I haven't heard anything. Meg, have you?
No, I haven't. I think that most folks probably didn't hear about it very much, I mean, I'm sure some folks did, but I think that there's so much like misinformation and lack of inclusion and messaging and stuff like that we haven't heard much about it.
The thing that I have heard still is like asking people, they're kind of hesitant, and then you're like, it's the 1-dose one, and they're like, okay, I'll do it. So I've actually heard positive things about the J&J even since it got pulled and then re-released. Is that people who would have said no if it was Moderna or Pfizer will say yes just because it's the J&J for side effect reasons and for 1-dose reason.
Matthew has a question in the chat. What are the numbers on first doses and second? Sorry, I had a message pop up. Is it hard to get those experiencing homelessness back for the second dose?
That's why our clinics are all J&J for that population, just because we don't have numbers on it, because we're trying not to do 2 doses for the houseless folks, because it would be hard, maybe impossible, because it's a very specific time frame that people have to come back, and the follow-up, there would be so many people lost to follow-up. There was a very big, like, oh shit moment when J&J got pulled in the middle of planning vaccines, because that was kind of like the magical answer for how to get people vaccinated. So we don't have numbers because we're not trying to do it.
We did a couple rounds of folks in the shelters, and that was a bit easier just because we were like, it was folks who were at our shelter every day. And so we were able to coordinate rides for them and to do that. And so we didn't see a drop off there, but that was really only like a few people, so I think just like what Katie said, we're trying to avoid it altogether. And I'm super grateful to public health for understanding why we need to do that, because I'm sure that that's not the case in every county, that the 1 shots are being prioritized for the houseless community. So I think that that's a huge advantage that we have.
There are also, too, besides just the complexities of having people follow up in that time frame to get their second dose, the big concern around trying to find a way to offer the 2 dose to the houseless community was just the reality that there seems to be a lot more severe side effects with the 2 dose ones. And then it's already really difficult to vaccinate someone with potential side effects who's houseless, but then knowing that like you may have a high fever and you may just feel absolutely horrible for 48 hours, knowing that there's really limited things we could offer to support that for like quality of life type of thing. That was difficult to even think about as well, because I know I got knocked on my ass on my second dose, and I can't imagine being that sick and not being in my house. And so we didn't have the ability to like scramble and figure out hotels and things to be able to give people 2 doses. So we were really lucky that the 1 shot was available again. I will plug Dr. Abdumalik has been really awesome, as well as the free clinic, in providing I don't remember what they're calling them, but they're putting together little kits to give to people when they get vaccinated if they're part of the houseless community, that has like soup, and I know some of them did sleeping bags and snacks and all kinds of like Tylenol and things like that as well, for people, like comfort bags after they get vaccinated, which has been super cool on their behalf, because we're really lucky to have a resource like that to give to people.
That's amazing. Comfort bags. I love it. Well, we just have a couple minutes left. Are there any last words? Trying to do my 10 seconds of silence.
I was glad I was able to make this meeting. I think the last time I talked to Meg, it was like forever ago, I think. So this is great. And I was educated and enlightened today. I really appreciate it. Thank you so much.
Yeah, super happy to be here. Thank you.
Yeah, thanks for sharing. Oh, Lawrence, sorry.
Oh, I was just gonna say thank you. Thanks for the discussion. It was great.
Yeah, I learned a lot as well, and I think these are important conversations that need to just